Now this P-shaped gland right here, this is the bulbourethral gland or the Cowper's gland. And you can see there's one on each side, there are two. And this has a small little duct that leads directly to the urethra, and it's below the prostate gland. And the bulbourethral gland or Cowper's gland doesn't actually contribute to semen, the volume of semen, but rather it actually will dump its contents before ejaculation. So this would be like the pre-ejaculate. And what the bulbourethral gland secretes before ejaculation is an alkaline mucus, which helps flush out the urethra of any acidic urine any residual acidic urine. It also helps lubricate the head of the penis, although majority of lubricating fluids will come from the female reproductive tract. And so again, we have our testis, which is going to be able to undergo spermatogenesis and produce haploid sperm. The epididymis will aid in storage and maturation of the sperm so that they're able to be motile on their own. And then when it comes time for ejaculation, the sperm will travel through the vas deferens all the way and then go into the ejaculatory duct. Seminal vesicles produce prostaglandins and fructose, and that gets dumped into the ejaculatory duct. And so sperm, fructose, prostaglandins, and liquid, right, will now travel through the ejaculatory duct into the prostatic urethra. The prostate gland contracts, secreting its substances directly into the urethra, which will be a milky fluid which helps activate sperm, as well as it contains that PSA, the prostate-specific antigen, which helps liquefy the sperm, or keep the semen rather liquid, not the sperm, the semen liquid. Helps liquefy the semen, and so now we have our semen, which will then travel through the urethra. But before all of that took place, the bulbourethral gland would have secreted an alkaline mucus to flush out the urethra and lubricate the head. And then the the semen would travel through the urethra, right, which travels through the penis and exits through the urethral orifice out of the head of the penis. And so this sagittal section through the pelvic cavity, there's lots of stuff that you should be able to identify. The fact that this membrane, right, that's separating all of this stuff from the organs of the pelvic cavity, this is our parietal peritoneum, which you can see all of these organs are located under that. So they're in the pelvic cavity, not in the abdominal pelvic cavity or the abdominal cavity. Here's the rectum. This is the anus, internal anal sphincter, external anal sphincter. So I just want you to be able to identify as much stuff. The bladder, urethra, these are all things you should be able to, ureter, these are all things you should be able to identify. Let's see. As far as external organs go, the external organs are the scrotum, which the scrotum is the sac that contains the testicles. And the scrotum, the reason why this has to be located outside of the abdominal pelvic cavity is, again, these testes have to be 3 degrees lower than body temperature to actually have viable sperm. Now, the scrotum is a very thin sac. It's essentially just a stratified squamous epithelium, epidermis, and then some subcutaneous, so epidermis, dermis, and some subcutaneous tissue, like loose areolar connective tissue, but no adipose. And no adipose because you don't want to insulate the testes. Again, they have to maintain a lower temperature than what the body is. And so no adipose located in the subcutaneous tissue. But there will be a little bit of smooth muscle scattered throughout the scrotum, and that's called the dartos muscle. The dartos muscle. And this muscle will contract when the testes are cold, so that when it contracts, it brings the testes closer to the abdominal pelvic cavity so that it can absorb some of the heat. And the dartos muscle will relax if the testes increase in temperature or become too hot, so that when it relaxes, it descends further away from the abdominal pelvic cavity so that it can maintain a cooler temperature. The penis, which is, this is the penis, which is leading out. It primarily serves as it contains the urethra for the exiting of urine during urination. So it serves as a vessel for urination. It also serves as a way for sexual intercourse. So the penis, once sexual stimulation has caused the penis to erect, it can aid in insertion into the female reproductive tract for sexual intercourse to convey semen into the female reproductive tract. And so if you look, the structures, you should be able to identify the different erectile tissues. And so this erectile tissue, which is on the dorsal side of the penis, this is the corpora, or the corpora cavernosum. Corpora is actually plural, corpus is singular, and so you're only looking at one. The cavernosa, which is on the dorsal side, there are actually two columns. And then the erectile tissue, which surrounds the urethra, is the corpus spongiosum. There's only one column of corpus spongiosum. So if you see the urethra running through it, it's the corpus spongiosum. If it's on the dorsal side and no urethra running through it, it's the corpora cavernosum. Now this enlarged area right here, this is specifically called the glans penis, which is the head of the penis. It contains ample sensory receptors for sexual stimulation. Now, in order to convey the semen into the female reproductive tract, first the penis has to undergo an erection so that for an easier insertion into the vaginal canal. And so what happens with the erection upon sexual stimulation, parasympathetic nervous impulses from the sacral portion of the spinal cord will cause vasodilation of the blood vessels in those erectile columns, the corpora cavernosum. And so you have this vasodilation, and blood begins to pool in those erectile columns. And when the blood pools in those columns, it causes the penis to become engorged and stiff. Now, upon further sexual stimulation, there will be an orgasm, which is a culmination of sexual stimulation, both physiological and psychological. Physiological because it causes muscle contractions, which helps propel the semen during ejaculation. Psychological because thoughts and emotions do come into play with whether or not an orgasm does take place. And then after orgasm, there's ejaculation, which emission is just when all of the semen accumulates in the urethra. So sperm coming from the vas deferens, prostaglandins, fructose, and fluid coming from the seminal vesicles, of fluid and PSA coming from the prostate gland, all accumulates in the urethra. And then ejaculation is the muscle contractions, which will aid in the forceful expulsion of the semen from the urethra. This is actually a cross-section through the penis, and this would be the dorsal side. This would be the ventral side. And here, so you can see these two columns. There are two columns of the corpora cavernosa, and there's these really large, deep arteries located in the center of each one of these columns. So when parasympathetic impulses upon sexual stimulation will cause these arteries to dilate, and blood begins to pool in these columns. Now, when blood pools in these columns, it enlarges and it compresses these veins on the dorsal side, these dorsal veins. And so what that allows for is blood pools in these columns but can't escape through these veins, right? So the penis will remain erect. Now, the corpus spongiosum, which is the erectile column that surrounds the urethra, its main function is actually to remain pliable so that when these columns swell and enlarge and stiffen, that the urethra doesn't collapse. Because if the urethra collapsed, then the semen would not be able to make its way through the urethra and exit through the urethral orifice. Now, after ejaculation, so once the semen has been forcefully expelled from the urethra into the female reproductive tract, what happens is the blood will stop pooling in the erectile columns, and then so it will begin to drain, and these dorsal veins will then be allowed to drain the blood from the penis.